are in listen-only mode.
Good morning, and thank you for joining us for Medicaid Modernization Part 3, Connecting MCOs to Iowa's Public Health Providers. This is Part 3 of a 4-part series organized by the Iowa Public Health Association in partnership with the Iowa Counties Public Health Association and in consultation with colleagues at the Network for Public Health Law. My name is Janine Moody, and I serve as the Executive Director of the Iowa Public Health Association. It is my privilege to moderate this morning's session. A few housekeeping tips before we begin. Due to the number of attendees on this webinar, all participant lines will be muted. To submit a question for our presenters, please use the Questions feature in your GoToWebinar control panel. I will monitor all submitted questions and pose them to our presenters during the Q&A portion of the webinar. A few technical tips for optimizing your webinar experience. 1. Utilize a USB headset. 2. Use a wired connection versus wireless if possible. And 3. Close any applications on your computer which require large bandwidth. Please know that today's webinar is being recorded and will be posted within a few hours to the IPHA website, along with the other resources IPHA has compiled on Medicaid Modernization page under Hot Public Health Topics. The Iowa Public Health Association wishes to thank the Mid-Iowa Health Foundation and the United Way of Central Iowa for their generous support of this webinar series to address what Medicaid modernization means for Iowa's public health system and how public health and safety net providers can leverage this to improve population health. We invite webinar participants to learn more about the mission of the Mid-Iowa Health Foundation at www.midiowahealth.org and the mission of the United Way of Central Iowa at www.unitedwaydm.org. Now let's meet our presenters. To begin this session, we will hear from Barbara Chadwick, President of the Iowa Public Health Association. Barbara will describe what public health looks like in Iowa, specifically in the Medicaid arena. Her remarks will set the stage for the subsequent presentations from the participating managed care organizations who are represented today by AmeriGroup is represented by Lee Davison, Vice President of Medicaid Provider Services, Organization Specialized Programs. She's joined by Paige Lappin, who's the Provider Network Management Director. AmeriHealth Caritas is represented by Karen Frankovitz, who is the Behavioral Health Integration Lead. United Healthcare is represented by Paige Pettit, Associate Director of Provider Services, and Debbie Burke, Vice President, National Medicaid Network. We regret that WellCare of Iowa did not respond to invitations to join today's webinar. Now I will turn the presentation over to IPHA President Barbara Chadwick for her remarks. Okay, Barbara. Barbara, would you like me to show your slides for you? There you go. Barbara. Barbara, this is Janine. I'm going to show your slides for you, so you don't need to worry about that.
Okay. I've lost my audio. Is going in and out again.
Well, we can hear you, Barbara. I can hear you. You're back. Go ahead. I'm showing your slides for you if you want it, if that's easier.
Okay. All righty. Welcome everyone. This is, as Janine said, a part 3 of a 4-part series, kind of educating all of us and getting our questions and answers and that kind of thing as we move forward with this new partnership. So what I would like to do is talk a little bit about engaging with the MCOs and local public health. And is that a good partnership in this whole mix? And absolutely, my answer is yes. So what might this partnership look like, and how will we work together? The objective of my quick 10 minutes is to provide an overview of what public health looks like in Iowa, including the kinds of Medicaid services that we're already providing. In a high level, public health in Iowa, we are not all the same. When we say public health, you really need to do the drill down, get into the weeds, county by county. So we're not all the same. We don't all provide the same services, nor are they delivered in the same way. Because immunizations are provided here in Lynn County may not be how it's done in Polk County or Braemar County, etc. Bottom line, there are 101 unique local public health agencies in Iowa. That's a lot of us. Probably the big word is that we are very diverse. And diverse public health agencies means that there are very diverse Medicaid services. And we have worked with the Iowa Department of Public Health, who has compiled a list of public health Medicaid providers. Who are the providers and what kinds of programs are we providing and services, a variety of types. And those Janine had referenced during the introduction on our website, IPHA. There is a tab that will link you back to this provider list to IDPH.
Barbara, excuse me, this is Janine. I'm going to take the presentation back from you so that I can enlarge your slides a little bit. A few people have noted that they're not seen in full view, so if you can let me have that back, and I'll catch up with you. Thank you.
All right. Can you still hear me, Janine?
Yes, ma'am.
All right. So in this provider list, I am so sorry with the technical difficulties I'm having here. The types of services that we provide we have screening centers. Some of the health departments have screening centers where we do a variety of screenings for immunizations, acute infections, chronic conditions, etc. We have maternal health centers. Behavioral health is incorporated in some of the programming. Lead inspection and lead inspection programs that would include not only analyzing elevated blood lead, but also the home safety inspections. There are health departments that have funded substance abuse assessment and treatment services. Family planning, Title X services are in a number of the public health centers. There's a high number of local agencies that provide home health. Some of us have our own independent labs where we do lab analysis and so forth, like lead analysis, and certainly some of the point of service testing as well. And a fair number of local health departments providing rehab services, the physical therapy, OT, ST, etc. So that diversity, those are some of the programs that are provided, but then, what does that translate into Medicaid funded services that carry their own ICD-9s and CPT codes and all that kind of thing? One is a significant amount of effort and energy and resources are devoted to care coordination. We may do screening, for example, but we're not a medical home. Most of us do not provide primary care, so we identify needs, gaps that our constituents might need, and we coordinate, we refer into our provider network locally, and so forth. Terribly important to address some of those barriers in access to care, and that is one of the essential services, core functions of public health. Most of us will have an interpretation service where so that we can address the needs, again, of our targeted population. For the most part are the uninsured, underinsured, those folks that are falling through the cracks. And many of those do need interpretation services. Non-emergency medical transportation is provided by some county health departments. B3 services, and those are the peer support and advocacy, direct care, community worker type activities. Diabetes equipment, supplies, education are provided. Home health, and the whole array from skilled nursing through CMA to homemaker services. Immunizations, and both for the VFC for children, adults, some with Medicare and the senior citizen immunizations, and private pay, travel immunizations, and so on. A variety of lab tests with all the services we provide, a high number of those point of services, CLIA waived testing that can be done at the local level, as well as obtaining the specimens and moving those on. Maternity and pregnancy services, medical transportation. Continuing screening for Pap tests. Sometimes that's provided through the Family Planning Title X programs, but also through our early cancer screening programs, the Care for Yourself program, whereby, while we're taking away or addressing some of the barriers and that kind of thing and referrals in our community, some health departments have the capacity and the infrastructure to actually, while you've got the client here, let's do the whole thing, which includes Pap tests. Screening mammography, and again, whether that's on-site or through community network partners, is hugely significant. We partner locally here with our local hospital that has a mobile mammography unit where we can, literally go across the state to take the services to where the women are, and that works beautifully. Skilled nursing services, huge emphasis on tobacco cessation, particularly for pregnant women. AIDS and HIV parity, huge program here in Iowa. Maternity pregnancy services, both pre and postnatal services. Preventative care, a lot of health education, that primary prevention effort, as well as a growing, in the state of Iowa, refugee health services. So that's kind of the big picture of where we're, the kinds of billable Medicaid services we provide. Rectal cancer screening, we do sexually transmitted infections, Pap smears, pelvic exams, again, a very significant need here in Iowa. Well child care, urgent care. Again, it's not an urgent care center at the health department, nor medical home, but sometimes we have folks that, due to waiting lists in the community, their primary care provider, they're in a residential treatment center, and there's just some urgent kinds of needs that need to be addressed, respiratory illnesses, etc., that are provided. Non-emergency medical transportation, newborn child care coverage or home visitation, nursing services, and nutritional counseling. All of those can be found. I've put some references here that would be very useful if MCO staff haven't visited these sites. One is the IPHA, Medicaid Modernization tab that Jeannie had referenced, is an excellent source with direct links to the IDPH Medicaid Service Provider Crosswalk, and that's where I had pulled some of this information here, who's providing what kinds of services. And that crosswalk also has a very good listing of some of the other grant-funded programs, where are some of these services being supported and supplemented to the Medicaid funding. And then the IDPH listing of public health Medicaid providers. Again, who are the providers out there across the state, whether it's nursing, home health, substance abuse, physical rehab services, etc. Wealth of information. And with that, Janine, I'm done.
Okay.
Thank you.
Thank you, Barbara. And now we'll turn the presentation over to Lee. Davison, excuse me, Lee Davison with AmeriGroup. Lee, let's check your audio.
Hi, can you hear me clearly?
Very good, and I'm giving you control of the screen.
You can go ahead and just show that one slide. It'll be fine.
Thank you.
Are you going to take it back?
Yes, ma'am. Sorry, just a moment.
Okay.
You can go ahead and start speaking, Lee.
Okay, great. Thank you so much. So AmeriGroup is very excited about being selected as one of the 4 MCOs to implement and both administer the Iowa Health Link program. We are committed to partnering with you and collaborating in addition with our members, providers, and stakeholders throughout the state. I think one of the things to know about AmeriGroup is we are a wholly owned subsidiary of Anthem. And through our affiliate health plans, we actually have more than 5.2 million beneficiaries of state-sponsored health plans. And right now that's in 19 states. And of course, Iowa, come January, will make the 20th state. We are used to working with public health departments in all of our Medicaid states. We welcome and understand the diversity of each one, and knowing that we have to work with each one of you as far as contracts are concerned. Each of you have diverse programs that you offer, based on what's available within both your counties or your regions. And so it's very important for us as Paige works with you to understand what those nuances are, that we can make sure that we're contracting appropriately with you. We do understand that many of you do not provide primary care services, and that's very similar to what we've seen in other states. And we are used to seeing, more than 90 counties. We have several, as you start to look at Georgia and many of the others, where you're up to 150-something plus counties. So it's very important with us to partner with you. We are currently in the process of hiring key staff. We do have a location in Des Moines that we have an office set up, and we're looking for 2 other offices within the state. And we're continually hiring people, both provider relations staff as well as marketing, customer service, claims, etc. I think some of the things that you wanted us to look at as far as long-term plans is engaging the public health department. As we get our staff up and running, it's going to be very key for us to make sure that our staff is working with you and collaborating, looking at where you see key gaps in the marketplaces, and making sure that we can collaborate together on how we move forward to make the program better. And so I just want to thank you for taking the time and allowing us to join you. We look forward to working with all of you and making sure that this is a collaborative approach. And so with that, Janine, I'll give it back to you, and then that way we'll have more time for questions and answers.
Very good. Thanks so much, Lee. Next, we will move on to Karen Frankwitz from Mera Health Caritas. So, Karen, can we check your audio? Okay, Karen, I can see your screen, but we can't hear you. Can you go ahead and speak? Let's see what's going on there. So Karen, I know during our practice session you were muting yourself or working on dealing with your audio. You were successful because now we can't hear you. So whatever you were able to do, can you try to turn yourself back on? Karen, let's do this. Let's move on to our next presenter and have you hop off and then call back in, and let's see if we can resolve your audio issues that way. So with that, let's move on to Paige Pettit from United Healthcare. So Paige. Paige, are you there?
I am. Good
Great.
morning.
Okay, Paige, I'm sorry about this. Do you mind if we go a little out of order here and make you the next presenter?
No, that's fine.
Thank you.
Absolutely.
Very good. Okay, thank you.
Absolutely. So good morning, everyone, and thank you for the opportunity to visit with you this morning. My name is Paige Pettit, and I am the Associate Director for Provider Services here at United Healthcare. Let me just get started by saying I really appreciated the insights that were shared at the top of the presentation. We are very familiar with working with public health entities throughout the country, but it's always good to hear what is specific in the state of Iowa, so very much appreciate the feedback this morning. A little bit about United Healthcare. Our mission is to help people live healthier lives, and United Healthcare is a community plan in Iowa with the mission to help folks live healthier lives. We operate health plans in Iowa and have been operating health plans since the 1980s, serving a wide range of Iowans, including those who are covered under our commercial plans, under our armed services, and Medicare plans. We've also served children in the state of Iowa under the Hawkeye program, and we have been in business with those programs since 2000 for the Hawkeye piece. In 2006, we acquired the John Deere Healthcare program and have been dedicated to providing service from all walks of life since that time, and are very, very thrilled to be now involved in the Medicaid program. So the focus continues to be, from United's perspective, to focus on integrity, compassion, relationships, innovation, and performance. A little bit about us. Again, we are in the state of Iowa and have been doing business here for a considerable period of time. But just to overview again, from United Healthcare's perspective, we have the employer and individual, which is our commercial line of business. Community and state, which is now the Medicaid line of business and was serving the Hawkeye population. Medicare and retirement, and then military and veterans for the TRICARE program. Also under the United umbrella is Optum. So some of you may have worked with our Optum partners. They do the contracting and oversee programs as it relates to behavioral health. They also oversee and manage programs as it relates to physical health, occupational, and speech. So we're under one umbrella, and just wanted to give you a snapshot of what that looks like today. We are located across the country, have been very, very focused on additional expansion, and so just giving you a visual of the services that we are engaged in. We have TANF programs, CHIP programs, the aged, blind, and disabled, special needs programs, Medicare, Medicaid plans, long-term care, and rehab across the country. Again, just highlighting the membership that we have in place today, and are again looking forward to adding additional numbers under our new Medicaid contract in the state of Iowa. Just another synopsis and a little bit of an overview on operating health plans since the 1980s, serving Iowans no matter what life brings them. We currently offer benefits for those covered through the commercial line of business, the Medicare, Hawkeye, and TRICARE programs. Some things that we'd like to just make sure people are aware of are the innovation and partnerships that we have been doing across the country and intend to do here in the state of Iowa. We focus on the patient-centered care, so it was great to hear all of the services that are provided under the various departments of health, understanding that there is no primary care, but the services that you all provide in those various locations certainly supplement all of the relationships that we're building across the state. We've invested in technology. If you have been exposed to the Hawkeye program, you've likely heard about the baby blocks and community rewards, and then have key partnerships with Sesame Street and with the National 4-H Council. We will continue those relationships and partnerships across the country, and we'll be introducing you to those through some of our community outreach programs that are available today, and will likely be coming to your community soon. Just want to make a point that we actually are located in the Des Moines office. We are off the Jordan Creek Parkway exit here in West Des Moines. We have a complement of staff. We have provider advocates here to serve the central part of Iowa, and then have additional advocate staff across the state. Case management is underway, and we are establishing the case management services based out of our Des Moines office as well. We will have an office in the Quad Cities that will be doing much of our customer service and claims processing. So we are here to help and serve, strive to be very active and visible in both the rural and urban communities to provide education to not only providers but to our members. You will likely see at community outreach programs our Dr. Healthy Hound, so look for the mascot as it relates to community and state. Again, our relationship with Sesame Street, and then other initiatives that we have underway. We're very much looking forward to getting out into the communities if you haven't seen them to date. One other thing I do want to mention, we are in the process today of putting together various webinar trainings. Now that the contracts have been completed with the state, we're moving forward with putting together educational opportunities. So this, I believe, today is the step in the right direction to do introductions, but certainly there will be other things that you all will want to be engaged in and discussing with the various MCOs. So we will likely be putting information out on the United website shortly to provide information as it relates to those educational webinars. So look forward to additional information as it relates to those opportunities. And again, thank you very much for the opportunity to share with you this morning. And we look forward to the Q&A session.
Thank you, Paige. Appreciate your participation and your presentation, and you're kind of rolling with our audio issues here. I'm going to pause the audio for just a moment. We're going to try to see if we can get Karen on the line. So please, everybody, thank you for your patience. I'll be right back with you. Karen? Karen? I can't give you one because of the way that, however it is that you're connected, but here's what I'm going to try. Can I just put the phone up to my microphone and let's see if people can hear you that way? Okay? Are you willing to try that? Yep, nope, stay right here, and if you want. Okay. All right, everyone, we're going to try an experiment here. Karen, can you go ahead and speak? Go ahead. I'm going to unmute one of our other presenters. And everyone, I'm so sorry. We're trying to roll the punches here. Barbara, are you able to hear Karen? Paige Pettit, could I ask, are you able to hear Karen? Can you go ahead and speak, please, Karen? Karen?
Janine, you can hear her, but very, very, very faintly.
Okay. Is it going to work or no? What do you think?
Unless she's got a healthy set of lungs and can speak up, I think you're going to have a difficult time having everyone on the line here.
I think so as well. Karen, can we try your audio one more time through the webinar, please?
Yes, what would you like me to do?
Are you able to turn up your volume on your phone in any way?
Nope, that's as long as it goes.
Okay, then I think that my best solution.
Want me to switch back to the conference call? I'm sorry.
That's okay.
Right at the beginning, I don't know what happened.
Okay. So Karen, we're punting here, everyone. Obviously, this is not how it worked during rehearsal, so I'm sorry about that. Karen, I'm going to go ahead and hang up on the phone with you, but ask that you try to continue to participate via the question feature if you're able to answer questions during that. And then I think what we will do as to make this up to the audience members and to Karen, so she has time as well, we will record a separate presentation from Karen at a later time and add that to this webinar so that you all can hear the presentation which she has prepared. And Karen, if you can participate at least with the question and chat feature, we'll be able to have you respond to people's questions that way. Okay? Okay, thanks, Karen. I'm going to go ahead and hang up the phone now then. Okay, so that's the magic of webinars. I'm sorry about that, everyone. I appreciate your patience with us. Obviously, that's not how it worked this morning or yesterday when we were doing all these practice sessions. But that concludes the presentations we're able to hear today from the MCOs. So now we'll go ahead and move into the Q&A session of the webinar. So I'm going to unmute all of our presenters. And remind all of our participants that it would be great for you to now begin submitting your questions. We do have a couple in there, so I'll begin with those. But if you want to ask a question of any of our presenters, please use the Q&A feature on your GoToWebinar control panel. And I'll start with one that we have in the queue here. And again, to our presenters, you've muted yourselves, hopefully, and when you want to weigh in on each question, please go ahead and do that. Okay, so first question, do any of the MCOs have plans to use local public health departments as telemedicine sites to increase access in rural counties and reduce the travel to distance to reach a provider?
So this is Lee with AmeriGroup. I think that's one of the things that we're committed to doing is for anybody that is interested in being a telemedicine site, then they would just let Paige know and we would connect you with our contact that'll be working the telemedicine piece. But that is very important to us and we think it's very important to Iowa as well.
Janine, this is Paige Pettit with United. I would agree. Those services are absolutely imperative in very, very rural parts of the state. So to the extent that those services are available, we're absolutely committed to working with the various clinics who may be using telemedicine. We've had conversations with folks at the University of Iowa around telemedicine, and so ongoing discussions taking place as that relates to those opportunities.
Thank you. The next question, we have had a contract with United Healthcare for several years. Will we be getting an additional contract for the Medicaid population?
The answer is yes. If you have an existing contract with the commercial line of business for services that you're providing today, an amendment to your existing agreement should have been sent out. If you've not received that documentation, then I would just absolutely suggest that you reach out to the contractor that you worked with, or feel free to reach out directly to me, and I will get you to the appropriate party here in the office to follow up on that contract.
Let's just ask everybody, as you're answering the question, to just please remind people which MCO you're with. So I believe, was that Paige speaking?
I'm sorry, yes. This
Okay.
is Paige Pettit with United.
Thank you. Okay, and let's just check one last time. Karen, are you on? Okay, we're going to keep moving on then here. Would the MCO contract with local public health to provide care coordination activities?
I'm sorry, Janine, can you repeat the question?
Sure. Would an MCO contract with local public health to provide care coordination activities?
Paige, did you want to start with that one?
Yeah, this is Paige Pettit with United. Absolutely. It's kind of fundamental to the work that we do today, Janine, is care coordination. At the time, let me give an example. If a patient has been admitted to a hospital, is in needing services post-hospitalization, we would have case management engaged in making sure that the individual has what they need post-discharge from a hospital environment, making sure that we coordinate with ancillary services in the community the individual resides in. So care coordination is something that we do today and absolutely intend to do it with the Medicaid, through our Medicaid program. Absolutely.
Okay, would anyone else like to answer that about providing care coordination?
Yeah, I think this is Lee with AmeriGroup. I think we would have to understand, what the public health departments are currently doing in care coordination and how that works within our organization to determine if that would be something that we would be open to.
I do want to answer for Karen. Karen's chatted in here that AmeriHealth would be interested in care coordination as well. Okay, next question. How are the MCOs going to handle contracts with hospital-based public health departments?
This is Paige Pettit with United Healthcare. Today we have contracts with all hospitals in the state of Iowa. I guess, to be honest, I'd like to have more specific information from the individual with that question. Not because I don't feel comfortable answering the question, that there are just nuances to contracting that tie to tax identification numbers and how those services are billed. So I would be very happy to answer the question if I had a little more specific information about the entity and how that contract is structured today.
Okay, well, let's pause here for a minute. Becky, may I go ahead and unmute your line and see if you can answer that or give a little more background to your question so that it could be answered? So, Becky, I've unmuted you. Are you able to speak so we can hear you? Becky? Becky Wolf? Okay, Barb, do you want to weigh in or provide a little more context for that? I mean, I can speak to that from my perspective, but I'd rather hear from a health department about hospital-based public health.
Yeah, and I really can't speak to it with any authority. However, there would still be, even though under the structure of a hospital based, they still are a separate entity in terms of the public health services, those things that are linked to IDPH, to other funders, certainly separate providers and NPI numbers and all that kind of thing for billing. It may be processed through the hospital system, but they really are, in that sense, an autonomous entity, I would imagine. But again, I'm not an authority on that at all.
Becky, I don't want to answer that. I want Becky to provide the context that she's talking about there. So Becky, I've sent you a chat. Are you able to, can you try to speak so we can hear you? Okay, just a moment. Okay, Becky, there you are. Our hospital is an affiliate of Unity Point Health. Barb's reinforcing our concern that we are a separate entity. So that's the point that I think Becky's making here. So I think that this is important, that something that we circle back to. So let's go. We have a lot of other questions here, so I don't want to take any more time, but let's come back to that. Okay, so moving on, when can we expect to see your signed contracts returned to us so we know we are part of your network?
So this is Lee with the Mirror Group. For us, once you've finished the contracting and credentialing component, then you would receive a welcome letter along with a returned signed contract. At the same time, you would receive follow-up from a provider relations staff to ensure that you're included in the provider relations training that would be rolling out both pre and post go live as well.
This is Paige with United. It's a very similar process that we would also be following once the formal credentialing is completed and the contracts have been signed. They will be returned with a welcome letter, and conversation about training also would take place. So very, very similar to other MCOs.
Okay, next question. What are the MCO's plans for handling non-emergency medical transportation? Will this be handled internally by the MCOs or contracted out with public health?
Paige Pettit, did you want to take that and then I'll follow?
Absolutely. We have very recently just signed an agreement with an outside vendor to manage the transportation piece of the agreement, and that contract will be then probably we will be reaching out or receiving information on how to communicate with us to engage those contracts. So absolutely intend to provide transportation. A vendor has been selected and is in place, and for those folks who have actually reached out to us previously, those requests have been shared with the vendor, and likely contract information will be coming shortly.
Okay, thank you. And I'll answer on behalf of Karen Frankovitz. She says that AmeriHealth Caritas has contracted with a vendor to provide. Okay, and we'll move on. Oh, I'm sorry.
And the same for AmeriGroup as well, too.
What's the MCO plan to address exacerbated health conditions as a result of changing case managers and the lack of local ground level knowledge of resources by the MCOs?
Janine, this is Paige Pettit with United. Can you please repeat the question? I want to make sure I understand.
Okay. The question reads, what's the MCO plan to address exacerbated health conditions as a result of changing case managers and the lack of local ground level knowledge of resources by the MCOs?
Well, I would just say that first and foremost, we are working with case management entities and individual case managers in the state of Iowa. We are also in the process of hiring staff for case management services here, and we fully expect that there will be an integration of those services, understanding that those case managers are local. So we'll be working in conjunction with those folks who are currently providing those services to prevent the types of exacerbations that you've just mentioned.
Okay, thank you. Does anybody else want to respond to that question?
I think it's all very similar for all four of us, quite honestly.
Okay. And Karen, let's do just for fun, let's see if your audio is working. Can you try to speak again? I know we're doing the chat feature, and Karen's responded here as well with AmeriHealth Caritas. We will continue to work with the case managers to utilize their knowledge and experience with the Iowa resources. We have also hired staff who are local and have that same knowledge base. Okay, so let's move on to the next question. We are a small local public health agency. We do not use a clearinghouse for billing. Do the 4 MCOs have free direct data entry for billing?
So this is Lee with the AmeriGroup. We do. We actually, through our website, you would have access through Availity, and Availity would have direct web submissions that you could submit claims, check status, check eligibility, check status of authorization, all of that would be available to you through the web.
The same applies for United Healthcare. You would have the ability to submit claims through UHC Online.
Okay, and Karen with AmeriHealth, I'm giving you a chance. Do you want to chat back your answer on that about direct data entry, free direct data entry for billing? Okay, I'm not seeing an answer from Karen, so we'll go ahead and move on to the next one. Will you use the care coordinators that are currently being utilized in the Title V agencies for EPSTD, dental care coordination, etc.? And while you're chewing on that, let me just answer for Karen, back to the question about the data entry. She said they have a provider portal that I believe will meet this need. And then back to the question about care coordinators. Will you be using the care coordinators that are currently utilized in the Title V agencies for EPSTD, dental care coordination, etc.?
Janine, this is Paige Pettit with United Healthcare, and rather than continue to have this pregnant pause, I'm just going to go ahead and stop. There are some questions. I'm going to be just completely transparent. There's some questions that we're working through with the state. We're actually meeting with the state on a almost nearly daily basis to work through some questions that exist. And so I will tell you that we do have some questions around the Title V program and are seeking clarity from our state partner. So just as soon as there is some answers to some questions I think that all MCOs have today, we will happily respond to that question. But I apologize, there are just some things right now that we're working through with the state.
Thank you, Paige. That was very eloquent.
Okay. And I'll say that almost everybody who's on this call, as we were doing dress rehearsals, testing out the technology, truthfully, to make sure that it worked when we did it earlier, I heard those kinds of comments expressed from most people. This is just such an evolving thing, and we've heard from IME when they did a presentation for us as well. There are things that they're figuring out, so the answers to some of these questions might be really different if we repeated this webinar in a week or two. So I will go ahead and move on to the next question, but thanks for asking that, Danielle. We currently provide local transportation and care coordination to link Medicaid members to providers. Will we still be able to provide this service?
This is Paige with United. It's a transportation provider that is just asking the question as to whether or not they can continue to provide transportation services. And if that's the case, the answer is yes. They would just need to be contracted with the vendor for probably any one of us MCOs. They'll just need to be contracted, and then we'll certainly continue to provide that service in those communities.
Janine, this is Karen from AmeriHealth Caritas. I would agree as well.
Karen!
Yes, and the same with Lee with AmeriGroup.
Okay.
So welcome, Karen.
Yes, how delightful to hear your voice, Karen. Thank you. Okay. Let's maybe, Karen, I will put a pin where we are in the questions, and maybe, Karen, if you would like to go ahead and do your presentation as planned, then we can come back to the questions. Is that acceptable?
Yes, I will run through it. I appreciate that.
Okay, thank you. So all the other presenters, if you'll just go ahead and mute yourselves, let's give Karen the floor here, and we'll come back to these questions, and I know exactly which one we left off with. So thank you.
I apologize for the delay. Thank you for giving me the opportunity to talk about AmeriHealth Caritas. Okay. We are, can you do the slides for me? Here we go.
Would you like me to move your slides for you, Karen, or can you go ahead and hit
okay,
up at the top
great.
where it says slideshow? If you'll hit that button right up there, press where it says slideshow, and then up in the middle, over to your left. Or I happily do you know what? How about I just do your slides for you?
You just do it.
Okay.
We are a leading Medicaid managed care company with a unique mission-driven care approach. We have a differentiated model of care operating in 16 states and the District of Columbia. We serve approximately 6.9 million members through a variety of services. We have strong experience in managing diverse populations with complex health needs. We have experience, with the TANF population since 1983, the age, blind, and disabled since 1997, and we have operated a Medicare and Medicaid program pilot demonstrations in 2 states. We support provider health plans in Kentucky since 1997 and also in Indiana from 2004 to 2015. We first started off as a small provider and have grown, but even through our growth, we still emphasize that we help people get care, stay well, and build healthy communities. Next slide, please. We have multiple product lines. We have the Medicaid managed care, full risk and non-risk. We also have Medicaid services for dual eligibles. We have behavioral health and pharmacy health care as well. As you can see nationally, we have many plans in the different states. We also have the pharmacy benefits, behavioral health care, and the Medicaid third-party administration. I'm on slide 4. Next slide, please. We have an integrated model that blends physical health, behavioral health, long-term services, and supports. We have pharmacy, and we have a holistic model of care that uses population-based health management programs to provide comprehensive care management services. We have a unique set of tools and experiences that drive our high quality and cost approach to LTSS. We also use an interdisciplinary member-centered approach that focuses on all aspects of a member's wellness, including social support. And this model results in better outcomes for our members and lower costs for our state partners as well. We have a person-centered approach. We have 30 years experience serving Medicaid population, and we understand the needs of this at-risk population. We engage, educate, and empower members to actively participate in improving their health and self-managing their health conditions. We provide members with the information they need to improve and manage their health. We also involve members and partners and guardians in the care team providers, behavioral health care providers, social services, and community group representatives in the care plan and management process. We also utilize community-based services to avoid or delay institutional-based care, supporting members who would like to remain in their home and involved in a community-based setting. We also incentivize and reward healthy member-specific behaviors as well. We Perform Plus is a portfolio of value-based incentive programs that we have that are designed to encourage the right care at the right place. We have provider groups, hospitals, and integrated delivery service systems who are rewarded for achieving key quality performance indicators built around evidence-based clinical practice and achieving their targeted measure outcomes. We will have a reward program for physicians for timely, appropriate ambulatory care and positive patient outcomes. We also have reward incentives for HEDIS measures and other quality measures. And more than 40% of our managed care membership across all markets receive care from a provider that participates in one or more of our Perform Plus value-based programs. We also have several different member engagement programs that we're really proud of. One is through Bright Start. It's our prenatal maternity program that provides support for members who are pregnant. We provide educational materials and promote the use of the 17P. We also do outreach calls and events, including community baby showers. We have Moms to Be, which is a federal lifeline phones and care management support. We also have a For Your Kids Care program, and that's focused on education for mothers of young children and related to how to care for a sick child, when to call the primary care provider, and the importance of regular doctor visits. We have a group setting that fosters the sharing and empowerment. We also have a Healthy Hoops program. That's our program for our childhood asthma and obesity program, and that's been a big success in other states. This was approved by the National Committee for Quality Insurance, and it has demonstrated decreases in inpatient and emergency room utilization. It has also increased the use of prevention inhalers and decreased the use of rescue medications. As far as technology and innovation, our contact center utilizes different technologies and dashboard tools to engage with members and providers. They have both member services and care management teams have access to the same alerts and data, allowing for collaboration of care and closure of any care gaps. These tools also enable members to take control of their health, providing support and coaching to facilitate desired actions. We also employ mobile technology to provide real-time, on-demand member access to benefit information, medication history, ID cards, provider directories, and PCP information, as well as sending reminders to address potential gaps in care. We have a track record of achievement. Many of our plans have the NCQA Health Plan accreditation. Also, other plans have the NCQA Multicultural Healthcare distinction. We have the NCQA Managed Behavioral Healthcare Organization accreditation, and URAC accreditation for Perform RX, which is our pharmacy benefit management line. We also have health clinic partnerships in Pennsylvania and other plans. They routinely collaborate with our health clinics. They offer health programs to promote health clinics as far as when to get your child sick and 4-week program, and that is sponsored by the American Diabetes Association. Teaches about diabetes and nutrition. We review monthly panel reports and assess when members are not seeing their primary care doctor for their needs. We have reports that are based on care gaps and HEDIS. We have provider network management and our public affairs teams to prioritize those clinics where support is needed. We also assist with block scheduling through telephonic unit for such things as cervical cancer screenings, mammograms, adolescent well care, and dental. We provide gift cards for members to improve the show-up rate and often make it more of an event that has fun things for kids like face painting to improve show-up rates. We also host a variety of events at clinics, like I talked about, the Healthy Hoop programs and the back-to-school events and health fairs. And in summary, we are a mission-driven company in regard to our members. We continue to serve a strong partner with the state governments and providers, and we are an active advocate for our members to ensure they get the appropriate care in the right settings. We further leverage our position to be a consistent thought leader for the industry and recognized as the leading in America for health for the underserved. We remain focused on helping people get care, staying well, and building our healthy communities. And that's it. Thank you very much for your time.
Great.
We look forward to partnering with everybody.
Great. Thank you, Karen. I'm glad that worked out, that we were able to get your presentation in. So we will now resume our Q&A portion. We still have a half an hour left, so there's ample time, so keep submitting your questions. I'll pick up the next question here for everybody. So again, for our presenters, if you've muted yourself, remember you're in control of that again. So the next question, if public health has a contract for home care with these providers. Would we need also a separate contract to be reimbursed for immunizations or flu shots at public health clinics? Some insurance companies seem to only want to reimburse physician offices for flu shots. So again, please remind everybody which MCO you're representing when you answer. Thank you.
This is Paige Laughlin. Can you hear me?
Yes, I can. You're just fine. Thanks.
Okay, good. We do have different contracts depending on services that are provided, and we will work with you to ensure that we've covered under our contract all the services that you are providing for the administration for those immunizations, as well as other Medicaid-covered services that would be billed on a HICFA, say, or for a UB.
This is Paige Pettit with United Healthcare. If you've got an existing contract today, we would just simply need to amend the existing agreement to add additional services. So I think that answers the question. Again, if there is a need for resource information or contact information, please just let me know, and I can get you to the appropriate contracting team here in the Des Moines office to address some of those questions.
And this is Karen Frankovich from AmeriHealthcare TOS. Yeah, our provider network team would certainly work with you. I don't know the specifics on that, but we would definitely want to work with you to get those services met.
Okay, thank you. So next question. Do you need to complete a credentialing form for each NPI number in our agency, or one credentialing form for all services?
This is Paige Laughlin. We would work with the provider to contract in the way that works best for them, that could be accommodated on our side. We do not need to credential per NPI number, but we would credential per tax ID number and for the services that fall underneath there to ensure that everything is dotted and crossed so that we can adjudicate claims appropriately when they come in.
This is Paige Pettit with United. Our answer would be absolutely similar. The contracting is done at the tax identification level. We understand that there are times when there are multiple MPIs under a single tax ID number. We would just need to understand what services are tied to the various MPIs and then do the contracting as appropriate.
And Karen?
It would pretty much be the same for AmeriHealthcare TOS. I don't have the specifics regarding credentialing, so I would have to loop back with my provider network management credentialing team on that one.
Okay, thank you. Next question. This is a general question. Will the process by which our front office staff verifies Medicaid eligibility for a client and then contacts the client's primary care provider for authorization to perform that service at our location, in other words, immunizations, change? So let me read that again because I think I was a little choppy there. So let's use immunizations as an example. Will the process by which our front office staff verifies Medicaid eligibility for a client and then contacts the client's primary care provider for authorization to perform that service at our location, will that process change?
This is Lee with the Mirror Group. For us, as long as you're participating, it wouldn't require an authorization. So the main thing is just checking eligibility before providing services.
Okay.
Paige Pettit.
I believe that would be true of AmeriHealthcare TOS as well.
This is Paige Pettit with United. I'm going to plead the fifth for a moment. I am not entirely certain that those services would not require authorization.
If that
hey,
is Debbie.
Go ahead,
Debbie, that's okay, I can hop in and help you here. It's going to be the same as some of the other MCOs where if you are a participating provider, they do not normally require prior authorization. But again, the devil is sort of in the details and making sure the exact service. So these are things that could be covered as you're talking with your contractor. But generally speaking, if you're participating, they're not going to require prior authorization. And as everyone knows, there's also the time period that the state of Iowa is putting in place where even if you're not contracted initially, there's going to be a time period where services will be rendered and paid to non-PAR providers.
Okay, thank you.
Thank you, Debbie.
Next question. We attempted to enter into an agreement with one of the MCO companies to become a provider in their network for the provision of home health services. They turned us down, stating that they already have a provider in our area. Is this going to continue to be a problem as an MCO also?
This is Paige Lappin with AmeriGroup. We have not, to my knowledge, turned down anyone for participation unless they didn't meet our credentialing criteria. But it didn't have anything to do with geographic location.
This is Paige Pettit with United Healthcare. If there's been a situation where you've experienced that kind of feedback, I'd be interested in knowing. To my knowledge, I'm not aware that contracts have been declined unless they're coming from a, let me just say, if there's a situation where you have been declined for any reason, please bring that to my attention and I will happily look into it for you.
And this is Karen at AmeriHealth Caritas. I'm not aware that there's been anybody turned away for contracts in regard to home care. But if that is an issue with AmeriHealth Caritas, like Paige said, I would be interested in knowing about that so I could follow up on my end as well.
Okay, that sounds like perhaps an opening for the question asker to pursue. Thank you. Next question, and this is directed specifically to United. I heard you state that case management services would be based out of Des Moines. Does this mean you would not contract with local case managers to service their communities?
My apologies. We will have case management on site in the Des Moines office. We will also be contracting with case managers across the state. So absolutely, we will work with case managers in all locations, rural, urban, and in the Des Moines office. So my apologies if I misstated that.
Okay, thank you. Next question. When will we see the rate sheets now that the contracts have been signed between the state and the MCOs?
This is Paige Pettit with United. There are ongoing conversations with the state that are taking place. There are some outstanding data elements related to payment methodology that we are working with the state to collect. So as soon as we have all of that information, we will absolutely be posting that and sharing that with you all.
So this is Lee Davison. Oh, go ahead, Paige.
I just wanted to say that we feel pretty much the same as Paige Pettit with United, and we are continuing to work through and get some final details done, and once that's done, it will be disseminated to the provider network.
AmeriHealth Caritas would need to get back to you on that. I'm just really not sure, so I'll have to circle back with my provider network team on that one.
Okay, thank you. Next question. Does each MCO have an established fee structure? Well, I think that's probably related to the previous question for services starting July 1. And so am I correct in saying that's all still unfolding?
I think that's a fair statement.
I'm going to say that the next two consecutive questions are pretty much the same question. So clearly, if we're keeping score here, there is a great demand for that information. So we'll skim over the next few. And let's see, next one. Contracts did not include an option to check mark all the services. I'm sorry, was I muted there? Let me start that again. Okay, I apologize. It's a long question and I was muted. Okay, contracts did not include an option to check mark all the services that are provided by local public health. We had to write in those services into the contract. Are we able to include additional services in our contract that were originally stated that we would not be able to provide? Can we now include those services and amend our contracts?
This is Paige Lappin with the AmeriGroup. I'm not sure I understand the question in totality, but this would be my initial response. That we intend to include anything that is Medicaid covered for the Iowa Medicaid members, and our contracts don't specifically ask for services, but we do have a credentialing application piece that would ask for that information. And if there's a service that's not listed on that application that is an Iowa Medicaid covered service and you would like us to consider you for that, we would have asked you to write in that information to make sure that we've covered all bases with you and that we can continue to work together for those members.
And before everybody answers, let me just repeat the part of this. The question is that are we able to include additional services in our contract that were originally stated that we would not be able to provide? So it sounds like something has changed there from the asker's perspective. Does that clarify the question?
I think we would probably have to talk to that individual directly to understand specifically what they're looking for. The contracts, at least on the AmeriGroup side, cover covered benefits and services, and so your application actually looks at the services and scopes that you provide and what you're credentialed to, and so there are actually two different components, and so that would probably be one that we would need to take offline with that individual to discuss.
I would echo the comments. This is Paige with United. If there have been additional services that you have added since signature of an agreement, then certainly we would just need to have you bring that to our attention. And if it's covered under the existing program today, we could absolutely consider it. You just need to bring it to our attention.
Okay, I'm going to go ahead and unmute the person who asked the question just to see if there's any clarity that can be added to the question. Right now, Carrie, are you able to chime in? Carrie, I unmuted your line if you want to add anything to that.
Can you hear me?
Yes, go ahead. Thanks.
Okay. So there was quite a rush at the beginning to try to get contracts established, and not having a clear, definitive roadmap to go down, and the information that we're gleaning now having these conversations. So like the transportation component, the care coordination components, the immunization components that trickle across multiple programs. Our Title V provides, different kind of programmatic services, in which I'm hearing you say earlier in this conversation that, you're still working out some of those bugs with the state agency, which thank you for doing that. But originally the message was that those were not going to be included, or we didn't know if they were included or not. And so my question is exactly what I had written. We had signed preliminary contracts to make sure that we could provide the services that we needed to provide, but upon receiving additional information from all these meetings that we're now attending, we want to make sure that the enhanced services that are Iowanized are included in our contracts. And originally they were not.
Okay, thanks, Carrie. I'll go ahead and mute you and see, does that additional detail on the question, does that change anybody's answer?
I think we would still want to follow up with her individually just to look at the scope and look at what she's because many of the services such as immunizations would be covered under the current contract, but I think as you start to get into some of the other nuances, it'll be better for us to work directly with her to answer those questions or anybody else that has them directly, since it's getting into the detail of the contract.
Okay.
I would agree.
This is Karen at AmeriHealth Caritas, and if there's any issues with the contract, you could let me know, and I could put you in contact with our provider network management team. You know, we want to work with you, make things right, but I can't answer that question, but certainly provider network management will be happy to work with you on that.
Okay, thank you everyone. And so just a reminder to all of our attendees on the webinar, the slides that you have seen me present, this is Janine with IPHA, those moderator slides that had everybody's email addresses, I will post those to our website. We won't be posting any of the MCO slides for proprietary reasons, but we will post the IPHA slides, so you'll have their contact information there. So moving on to the next question. I know that AmeriHealth has just recently signed the contract with the state of Iowa for this Medicaid modernization. Has UHC and AmeriGroup gotten this contract signed as well? Has the state of Iowa forgotten, or I'm sorry, I think the answer is yes, everybody signed their contracts. Has the state of Iowa received federal approval for Medicaid modernization program?
So this is Lee with AmeriGroup. All the MCO contracts were due to be signed in on Friday last week, and so everybody's has been turned in and signed with the state. As far as the approval, that would need to be followed up with the state from CMS.
Yeah, I think that's the answer, so I don't know that we necessarily need to go around. Does anybody else have anything to add to that?
I think that was an excellent answer to the question.
Okay. All right. Moving on. We still have quite a few questions here. So again, remember, go ahead and get those submitted if you still have anything burning. Can the MCOs say who their transportation vendors are since they've already contracted with them?
For AmeriGroup, it'll be Logisticare.
For United Healthcare, it will be MTM.
For AmeriHealth Caritas, it would be Access to Care.
Okay, thank you. Next question. Okay, well, I don't know that anybody can answer this one, but I'll read it. Will the pending lawsuit against the state of Iowa by those entities that were not chosen for this Medicaid modernization program impede the start of this on January 1st? I'm not sure that that's a question for our MCOs per se. I can tell, this is Janine again from IPHA, and any of you who have been to any of those forums that IME is holding, this question comes up, and they are moving forward with their January 1st implementation. So that's the official answer from them. Next, if we already have signed contracts before the MCO signed with the state of Iowa, will those contracts be honored for any amendments or provisions that will be made after the fact?
Yes, with AmeriGroup. The state is currently reviewing the contracts and have sent back comments, so you may see additional information that would come back through an amendment, and Paige would be following up with you on any of those, but it would be very minor.
So this is going to be really confusing for providers, so I apologize. This is Paige Pettit. The answer for United Healthcare would be the same. So now you've got 2 pages in the Iowa market you're dealing with.
It was confusing for me in coordinating this webinar as well, but you're both welcome. I'm glad you're here. Karen, did you have an answer to that?
You know, we would work with you in regard to amendments or anything you wanted to add to the contract. So, I mean, that's really all the definite I could say. I mean, we would put you in touch with our provider network management team that would work with you on that.
Okay, thank you. Next question. Do providers have to pay for access to Availity or other similar access sites, or is it free?
For AmeriGroup, it's free.
This is Paige with United Healthcare. I do not have the listing of all the clearinghouses that United works with today in front of me. Out on the United Healthcare online website, there's all manner of information related to working directly through United and our clearinghouses. Many of those options are free.
Okay, and Karen?
Now, I'm uncertain, so I would have to, again, direct you to provider network management for AmeriHealth Caritas.
Okay, thank you. Next question. Why hire case managers that are only going to be able to work with clients who are signed with you, rather than contract with case management agencies who will be able to serve all clients in the area and have the local knowledge? That way clients will be able to keep their case manager.
Well, AmeriHealth Caritas will be working with the case managers in the community. We will be contracting with those providers. We will also be having care managers in-house as well, working with the case managers as partners.
And for AmeriGroup, we actually hire within the community, so many of those are those that already have relationships with members.
United Healthcare is doing the same.
Okay, thank you. When and how will we receive training on submitting claims to each of the MCOs?
Can you repeat the question, Janine?
Sure. When and how will we receive training on submitting claims to each of the MCOs?
So at least for AmeriGroup, we will actually have a formal training plan that will be rolling out and have seminars that will be both in person and through WebEx throughout the state. Those will begin towards the end of November and carry through the month of March. And so they would receive notification for which ones that they could sign up for, and they would have the ability to choose whether or not they wanted to do an in-person or WebEx.
United is
similar for, oh, I'm sorry, go ahead.
No, go ahead.
Oh, for AmeriHealth Caritas, that is similar. We'll have in-person training, and we'll also have webinar training. That will happen before January, the January 1st deadline, the live date, and you'll receive notification of that.
I'm sensing a common theme. This is United. The same situation for us. We actually have advocates located across the state and are available to be deployed to provide education. So it's just a matter of getting the information out on the website, and we intend to have that out relatively quickly. So stay tuned for more updates.
And Janine, I would probably add for all three of us, I mean, even though we do initial training, all of us do ongoing training and ad hoc training anytime that providers request it. In addition to when new providers come on, then we all typically do training within 30 days of their effective date as well.
Okay, thank you. Again, last call for questions. We have just 8 minutes left, and we still have a few more to get through here. Can you speak to the experience you have in other states in contracting with Title V and Title X programs?
Well, for AmeriGroup, I mean, as we stated, I mean, Iowa will be the 20th state, so we have been doing it for quite a while, and so we're very familiar with working with the title programs.
This is Paige with United, and Debbie, I know that you might have some familiarity. Again, we also are contracted in many, many states across the country. I don't, to be honest, don't have a line of sight to how those contract relationships were established outside of Iowa. I know how we're trying to work through the various questions as it relates to Title V and Title X. But it is not a process that we are unfamiliar with across the country.
That's correct, Paige. I mean, we do work with Title V programs around the maternal and child health, and we work with Title X as well across all of our markets. So it's a very common service, and we'll be looking to put in place those similar coordinated and partnerships in Iowa.
Karen?
I would have to agree with what others said. We are involved with other states, so I'm sure we have that background information and would work with Iowa to to implement those programs as well.
Okay. Next question. I am assuming that all of our Medicaid home health clients will need prior approval for continued services. Is this correct?
I don't fully understand the whole question.
Yeah, I don't understand the question.
Okay. Peggy, let's see if you're still on. I'll give you a chance to expound upon that. Peggy, I'm going to unmute your line. Peggy, can you check in here? Peggy? Peggy, I've unmuted your line. Can you expound upon your question? It says, I'm assuming that all of our current Medicaid home health clients will need prior approval for continued services. So this is essentially an eligibility question, right?
So is she referring to home health services that they're already providing?
She says,
okay.
Yeah, Medicaid home health.
Okay, thank you. I just want to make sure. So for home health services, you currently have authorizations that are in place, and so there's a continuity of care provision within the contract that if you have current authorizations, then each of the plans would actually honor those authorizations. However, for example, if you have an authorization, let's say that expires in February, then you would be responsible for working with that particular MCO to obtain an authorization for new services. And that information would all be provided in the training that each of us would be doing as you go prior to go live.
Anyone else? I'm going to keep...
That answer would be consistent for everyone.
Okay, I'm going to keep scooting this along here just so that we can get through them. For AmeriHealth Caritas, you mentioned population-based strategies. Are you interested in partnerships with local public health to design, implement, evaluate those? And for the other MCOs also.
Wow, you were breaking up a little bit. I heard population health and interested in collaborating with the public health department, and I missed everything else.
Okay, let me read again. I'll read it again. That's okay. For AmeriHealth Caritas, you mentioned population health, or population-based strategies. Are you interested in partnerships with local public health to help design, implement, evaluate those?
Yes, I mean, we would definitely like to work with you. You know the population the best in Iowa, so we would want to certainly work with you on those initiatives and see what your thoughts are.
And that would be the same for AmeriGroup as well.
For United Healthcare, this is Debbie Burke. We would, one of the things that we look at are your planning documents, statewide planning documents, as well as, sometimes they're local, obviously local planning documents, but if we look at those, we also look at the planning documents for the primary care health centers, the Iowa Primary Health Care Association planning document, and we look to partner across really both of those areas to see what are some of those population health initiatives that you are both focused on trying to improve, because they're going to be similar for our, our membership, which are your patients many times.
Okay. Will home care services such as skilled nursing or home care aid assist with a bath need to be pre-authorized?
I believe the answer is yes.
Yes, so just keep in mind, I mean, this is with AmeriGroup, I mean, you'll have current authorizations that exist through the continuity of care that we all will have to honor, and then at that such time that either assessments are updated or that authorizations expire, then you would be required to work with each of us to get an updated authorization.
Okay, I'm going to keep moving just to try to get through the rest of these. Can the MCOs please slowly report or repeat the transportation brokers? I can't write quickly enough. So each one of you, again, you've already listed who your transportation brokers are. Could you say them again?
So for AmeriGroup, it's Logisticare.
So that's Logisticare for AmeriGroup. United?
Correct.
For United, it's M T M. M as in Mary, T as in Tom, M as in Mary.
Thank you. And Karen for AmeriHealth?
Access to care.
Access to care. Okay, thank you all. What if we have not started the contracting process? Where do we go with this information to begin? Or where do we get this information to begin? Is there a deadline to get this done?
This is Paige with United. If you will just send an email to, and I believe that Janine provided my email at the top of the presentation, I will happily be sure that your requests get to MTM and we can begin the process of getting contract information out to you.
And this is Paige Lapin with America. I'm sorry. This is Paige Lapin with AmeriGroup, and it would act the same way. If you could send an email to me, we'll make sure to get the information over to you.
And me as well. This is Karen
Okay.
from AmeriHealth Caritas.
Good. Hopefully that was the answer you were looking for, Lynn. Here's another question. How will the Vaccines for Children program be handled through the MCO? Currently, this has been a state program.
This is Paige Lapin with AmeriGroup. As I appreciate, it's going to continue to operate basically the same way where you would bill us for the administration component.
I apologize, Janine, could you repeat the question?
How will VFC, the Vaccines for Children program, be handled through the MCOs? Currently, this has been a state program.
I just actually saw some information about that in the last day or so. So, and I'll be honest, I will just be candid, I'm not entirely certain. I know there is ongoing conversation for, again, some of the programs that are transitioning. I don't have enough insight on the VBC program, so I will respectfully hold my comment until I know definitively how it's going to be handled.
Okay, and Karen?
I am uncertain, so that's something I would need to follow up on.
Okay, and I know we're just over time. We only have 2 more questions if we could go ahead and get those knocked out here. Will the MCOs have requirements for claims to be filed which will be different from Iowa Medicaid? For example, Iowa does not require the ordering physician name or the MP number to be reported on the claim.
I'm not sure about that question, so again, that would be something I'd have to follow up with.
So this is Lee. We can make available our companion guides for filing that'll give you, what are the required fields and what are the optional fields. But also, in addition to that, claims will need to be filed within 90 days of the date of the service. So that information will be provided through the training out on the AmeriGroup site. We do have our EDI companion guides available. Should anybody want to take a look at them. They are what we use across the states, and then should anything change that the state provides us, within the next couple of weeks, then we would make adjustments accordingly to that.
And the same would hold true for United.
Okay, thank you. We are a family planning clinic that serves clients for services that may be confidential from either parents or spouses. How would you handle those to ensure that the patient's respect for confidentiality is respected?
So within AmeriGroup, within our systems, we're used to dealing, with, confidentiality and knowing, such as sensitive information and what can be shared and not shared. And so we do put our whole entire team through, not only cultural competency, but they go through ethics and compliance training. And so through that, those services would be marked as sensitive, and so they would know when and not to share those. The same when we send, member verification of services out to members to verify services were actually provided, then for things that are in a sensitive nature would not go out through member verification of services.
That is precisely the same process that United follows.
AmeriHealth Caritas as well. We also have release of information forms for substance abuse information. So we would have to have a signed release by the member before we would share any of that information, just as one example.
Okay, thank you. Let's see, 2 more questions, and then we'll close off the questions here. One, something just popped in here. Will Hawkeye children be eligible for the Vaccine for Children's program, or will they continue to access immunizations from their medical provider?
This is Paige with United. I'm not aware of any changes in the Hawkeye benefit structure, but and at this point in time, I'm not aware of a benefit structure change.
And I would have to agree with Paige. That would be something we would need to follow up on, but I'm not aware of any differences.
Okay. Next question. So with so many things undecided, how can providers sign contracts with MCOs in good conscience?
For AmeriHealth Caritas, we have a draft version of our provider manual, so if that's something you would like us to send you, we can certainly send that to you.
Yes, and I think, Janine, we did provide a draft manual as well. I think, for us, all intents and purposes, I mean, we plan on mirroring, what currently is occurring, through the contract and the RFP, both with the Medicaid and with the waiver services. I think the things, where you start getting into some of the program details where we need, additional what we call in the weeds kind of stuff, is more how we operationalize things, but the overall structure and thing will be very similar to what you have today, other than how we, implement each of our nuances for the differences in how we operate.
And so I'm just going to plug this right now. I know that there were some things that were shared with me that weren't appropriate to put out on our website just for proprietary reasons, or they were very draft. Following this session, if any of the MCOs have materials that you are fine with us posting to our website, or you have a link to some of the information that you've mentioned here that you think it would be helpful for us to add to our website so people know that's kind of a one-stop shop, please follow up with me and we'll get those things added to the IPHA page.
Great, thank you.
Okay, another question. How soon will processes... You're welcome. How soon will processes and requirements for utilizing the transportation benefit through each of the MCOs be available so that we can begin educating our staff for helping clients? Also, I still somehow, this person's saying they missed the transportation broker for WellCare, and that's because WellCare did not participate in today's webinar. So you didn't miss anything from us. You would have to follow up with them. So back to the question, how soon will processes and requirements for utilizing the transportation benefit through each of the MCOs be available so we can begin educating our staff for helping clients?
This is Karen from AmeriHealth Caritas. That would probably most likely be included in the provider training that will be rolled out.
And I would agree. I mean, it'll be not only in the provider training, but it'll also be in the provider manuals as well. And then we do provide that information both within the member handbooks and some of the member materials that are sent out to members.
And the same would apply to United.
Okay, this will really be the last question. You've all been very generous by giving a little bit more of your time than was asked of you, and our attendees who have hung on over time as well. Thank you. Last question. What is the opt-out time frame for providers who sign contracts and then want to terminate their contract?
This is Paige with United. I think those conversations, in all due respect, contract conversations are confidential between the provider and the MCO. So I would just respectfully ask you to reach out to your individual contacts on the call today for information related to the provisions of your agreement.
And I would agree with Paige. So, click point, please.
Mayor Health Caritas as well.
Okay, thank you. And thanks everyone for being generous with your time here and running over. We'll go ahead and wrap up and say that on behalf of the Iowa Public Health Association and the Iowa Counties Public Health Association, I would like to thank all of our panelists for spending time with us this morning. I would also like to cue our audience into the next webinar, which we are planning for this series. The fourth webinar will be a peer sharing of local partners' experience in engaging with the Iowa MCOs to date. If you are interested in presenting your experience, you're feeling brave, and perhaps some tips and lessons learned, please email me, Janine Moody, at iowapha@gmail.com. All the webinars in this series are archived online at www.iowapha.org. Again, click on Hot Public Health Topics and then Medicaid Modernization to access them. At the conclusion of today's webinar, you will be directed to a brief evaluation of the session, and we'd appreciate your feedback as it will help us inform the planning for the remaining session. The Iowa Public Health Association again thanks the Mid-Iowa Health Foundation and the United Way of Central Iowa for their generous support of this webinar series to address what Medicaid modernization means for Iowa's public health system and how public health and safety net providers can leverage this change to improve population health. Thank you to all presenters and attendees for your time, and enjoy the rest of your day.
Thank you.
Thank you.
Thank you.